South Africa's public health sector has for years been overwhelmed. And now, with a global pandemic infecting more than 500,000 people here, public hospitals are under more pressure.
Why were we not given PPE in a pandemic, in a serious situation like this, where nurses are dying, the general public is dying, numbers are crazy as far as death related to COVID-19 is concerned.
More than 24,000 health workers have contracted COVID-19 and 181 have died since March. Unions and workers say corruption is contributing to poor service delivery and is putting lives at risk. While the government's given contracts to service providers for personal protective equipment, or PPE, the prices have been inflated. In other instances, PPE has not been delivered at all, or contracts have been given to companies and people connected to the government and the ruling African National Congress Party.
Difficult to put numbers on it because I think the stories are still coming out, and unfortunately, because of the lack of having good detection and preventative measures in place, we may only know about the extent of the looting 6, 7, 8 months down the line.
President Cyril Ramaphosa in a weekly newsletter has promised to deal with the graft.
Corruption during a national disaster is a particularly heinous type of crime. Those found to have broken the law to enrich themselves through this crisis will not get to enjoy their spoils, regardless of who they are or with whom they may be connected.
But Ramaphosa's chief spokeswoman, Kusela Diko, is embroiled in a scandal involving her husband, Thandi Sizwe. His company's been accused of winning a $7 million contract to supply PPE through his political connections. Diko's taken special leave and she and her husband deny breaking any laws. The province of Gauteng's top health official, Bandile Masuku, and his wife too have been implicated. When the first infections were recorded back in March, the government declared a state of disaster, which meant that the normal tender procedure for government contracts was abandoned. Within days of the announcement, a number of questionable contracts were awarded. Now, the Finance Minister, Tito Mboweni, says the process has to be more transparent. A government agency, the Special Investigative Unit, says 102 companies in Gauteng alone are under investigation. While in other provinces, officials have been suspended and investigations have begun, but no one's yet been charged or prosecuted. Corruption during this health crisis is estimated to have cost the country more than $116 million, at a time when South Africa is dealing with the 5th worst outbreak of COVID-19 in the world. Fahmida Miller, Al Jazeera, Johannesburg.
Dr. Regina Osh is an infectious disease specialist at the Aurum Institute. She says although the number of cases in South Africa is high, the situation seems to be getting a lot better.
It is very concerning that there are places where there's not a lot of testing and we're still seeing a rise in the number of cases. However, it's very difficult to predict what the implications of that, not testing, how the figures would look if they were doing more tests. Currently, our borders are still closed. So South Africa has had closed borders since March, and we don't have any movement in and out of the country, at least not movement of people. There's movement of cargo, but not movement of people. And so we're hoping that that's going to, of course, create an environment where cases are not being exported. South Africa is really, we are getting quite a lot of cases right now. We're probably going to get close to 1 million. When this is over, but I think that we have seen a little bit of relief in the last week or so in terms of the number of cases being reported, also in terms of the hospital burden and the number of people who are in the hospitals and the percent occupancy of the hospital beds. So I think things seem to be getting a little bit better. It could be just spurious because, maybe people are not testing as much, or maybe there's just some other reason. But hopefully that trend continues. Right now it's just a trend, but hopefully the trend continues, and then we can see in a few weeks whether we're actually over the hump. But of course, it's still going to take a long time to get down back to zero.